breast lift is a very popular topic these days with the amount of women I see who have had kids. A lot of women who come in for, quote-unquote breast augmentation consult, when I see them in the exam room, they actually have lift as the primary need for surgery, and then augmentation is the secondary need. So basically with the lift surgery, the main question is, well, what kind of scar am I going to have? How long is the lift going to last? Do I need implants or not? So with regards to those questions, first of all, implants, if you have enough breast tissue naturally, you don't necessarily need an implant at the same time as a lift. But if you want a lot of fullness in the upper breast, or you don't have a lot of natural tissue, then generally you're going to get a better result with an implant. Number two is, how long does the lift last? Well, unfortunately, it's kind of a potluck situation depending on your breast. So for some women, they're going to have stronger, better quality skin. Other women will have very weak, thin skin. The thicker your tissues are, the better they're going to hold up over time. Each year that goes by, you're going to lose a little bit of the shape, and eventually you'll have to have a revision surgery. So just keep in mind, breasts are high maintenance, unfortunately, when it comes to lift surgery. And then lastly, as far as scarring, again, it varies on the patient's breast. So, if you're really lucky and you don't have a lot of drooping, then I might be able to get away with the tightening just around the areola, which will help to tighten up the breast without causing a lot of any scarring on the lower part of the breast. Most patients, if they have significant drooping, are going to need what's called a lollipop scar, where they have a circle that goes around the areola and then a line that goes down the breast. But I generally try to avoid the scar that runs underneath the breast, because that can be a problematic scar for some patients. In the worst cases, where somebody has a lot of drooping, sometimes I have to do the anchor scar, but it's very rare, thankfully.